The number one cause of vision loss in those over 60 years old is macular degeneration. 1 in 3 people will develop this in the United States today. It's a condition that really is just so scary. Think about it, losing your central vision and not being able to see your grandchild. But more than ever, there's so much that we can do. I remember when I started practice in 1989, there was not much we could do. And then came on prevention, vitamins. You'll learn more about that when you're here, that might prevent 25% of the time taking the type of vitamins and zinc. These type of vitamins can actually prevent progression. But the number one thing you need to do is catch it at its early stage. By using an Amsler grid, you look at the lines, and if the lines are straight, you're fine most of the time. But if they suddenly become waved, you've got to call us immediately. So what is macular degeneration? Macular degeneration, think about it. If you take a magnifying glass up to the sun and you burn a hole in a leaf, well, that's a lot of heat. Well, that's what's happening in your eye. You've got a lens in your eye that, just like glasses, focuses the light, all the light in the world, right onto the very central point. It would burn instantly if the highest blood flow in the body wasn't by there cooling it. But over time, you start getting yellowish deposits, trash material that builds up called drusen. And this drusen starts to cause atrophy. The retina, the film of the eye, and you only get one roll for life, starts to becoming irritated by this trash material. And suddenly the photoreceptors, which are the cells that allow you to see, and the RPE cells that are the trashmen, if you will, that clean these cells, that clean the retina, that help give it nutrients, start to die. When they die, it's called dry AMD. You start getting Swiss cheese-like vision where you get holes of pockets of vision. And that's where vitamins and antioxidants and zinc are thought maybe 25% of the time to reduce progression. Now, what if you have this dry macular degeneration? Is there anything else we can do? Not yet, but there's so much research that's happening, and that's why we monitor you. But why do you go home and look at the Amsler grid and look at the lines to make sure they're straight? Because while 90% of people have a dry AMD, 10% will develop wet AMD in their lifetime. That's 1 out of 10, which is actually very high when you think that 1 out of 3 Americans will develop this. So wet macular degeneration, since I started in '89, what a difference. I remember in 1992 when I introduced indocyanine green angiography, which at that time was the second most important diagnostic test for macular degeneration, we started to discover placoid membranes. And these placoid membranes were actually wet AMD that we didn't know what it was lurking there that would suddenly bleed. So we did laser, hot laser, which often worked if you had polypoidal choroidal neovascular membrane, a type of wet AMD that you could actually laser. And even to today, you can laser that type. But 2/3 of wet AMD is not polypoidal. It's just regular Colt or classic membranes, and there was very little we could do other than burn the center of the vision. And lo and behold, 5 years ago, 6 years ago, we started coming up with intravitreal injections. We discovered that the retina, as it's starting to get sick, releases factors saying help, help, called vascular endothelial growth factors. These vessels or hormones are not normal, because in reality, you're only born with the retina vessels you have. And sick, dying cells release something they shouldn't release. Cancer cells work that way. How do they multiply? They're able to multiply by releasing something that causes blood supply to grow. Well, the same abnormal process occurs in the retina when the blood vessels start to grow under the retina and can suddenly break and bleed. You can either laser it with a hot laser. You can laser it with a cold laser that doesn't burn, and we were the first to own that laser back in 2000 in Pennsylvania after the FDA approved it, and it really worked. Patients sometimes had to stay out of the sun for 5 days, and it didn't work quite as effectively. But with these intravitreal injections, it is the most fun I've had. I guess it doesn't sound like fun injecting the eye, but it's really not that big of a deal. But the fun is when you can do something. When my grandmother couldn't have anything done to her, and I'm sitting there 25 years later able to save someone's vision because now we can make these blood vessels melt away because we create an anti-vascular endothelial growth factor, a factor that counteracts this hormone that should not be there. And so suddenly the blood vessels melt away, and we can show you an OCT. This OCT is the type of machine where it's an MRI of the retina, and you can see actually in this area where the retinal elevation decreases or increases over time, like a blister. You normally couldn't see it without the OCT. Well, when we inject with the chemical, you can see, as we're looking at different pictures, that the blood vessel melts away and the retina ends up going back to normal. Sounds great, only one problem. The medicine only lasts once a month. So that means 8, 10, 12 times a year we're constantly injecting. You wonder why it's hard to wait and be patient in a retina doctor's office. There's 30 of them, 30 retina surgeons like me for 5 million people. Think about it. We used to not be able to do anything, and we'd see the patient once a year, once every other year, and now we're seeing them 12 times a year, and it's overwhelming. But it's overwhelmingly exciting when we can preserve someone's vision. So we inject 8, 10, 12 times a year, and we hope one day there'll be a longer-acting agent that'll work. But right now, it's for the first time restoring people's vision, not just maintaining the vision. And that's wet macular degeneration, but you have to be our partner. The second you see a change in Amsler grid, or you look at a doorpost, and it ends up not being straight and it's crooked, come back in and we can treat you. So what do we do about macular degeneration to diagnose it? Well, there's 3 major tests. One is fluorescein angiography, where you inject a little bit of vegetable dye in the arm and you take pictures and you see the blood vessels that can leak because they're not normal when they're not supposed to be there. They actually leak. They're a leaky blood vessel, and you see the fluorescein leaking into the film of the eye. Then there's indocyanine and green angiography. This is one that's a much larger molecule, and as a result, it's kind of like I compare it to the small little Volkswagen versus the 16-wheeler Mack truck. The ICG is the 16-wheeler Mack truck that doesn't leak out of blood vessels. So it very clearly shows you in some cases, especially in a rare form of macular degeneration, polypoidal choroidal neovascular membranes, where that happens 30% of the time, where the leak is, and you can laser it without having to inject. And then the third test is OCT. The OCT is the MRI, and now the most important test, where you're able to actually look at the film of the eye and see how it's changing over time. And by constant injections, you can see if it's constantly working or not. You know when to treat or not. So the question is, can you prevent the disease? You can't prevent it. We think maybe ultraviolet light, you want to wear sunglasses. Some people talk about omega-3 and eating salmon. But we know that vitamins and zinc, 25% reduction in progression, can be effective in forestalling it. So you've got to check this with your family doctor. You have a very high dose vitamin that can cause some anemia and some bleeding disorders. So we're going to give you a sheet to bring to them or to talk to your family doctor about whether you can take this lifetime amount of vitamins, but it's very worthwhile doing. But now, what about if we don't succeed in injections? And what about if we don't succeed with laser? Do we give up? No, you don't give up. You know, this is what made me go into medicine. Someone said to my grandmother, "Give up," when she couldn't see my face. You don't give up. It's only macular degeneration. Thank God it's not a blinding disorder. It robs you of your central vision. So let's teach you to use other parts of your vision. And I'm so honored to work with people like Dr. Brilliant and Dr. Crozier. As a team, they're arguably one of the finest in the world. And they will spend hours maximizing your vision after we do the best we can to preserve your vision. Please, ask us any questions. We're here to help you. We don't always succeed, but we always try. And we will leave no stone unturned until at least your vision's the best it can be. Thank you.